Hello, good morning and good afternoon, wherever you may be. It is 9:02. We have some of our participants here, not all, but we could start and then admit them as and when they join. My name is Emosla, and I would be moderating this webinar. My day job is lecturing at the University of Ghana School of Public Health. Today, I represent the African Nutrition Society in the webinar as its president. As you are all aware, the COVID-19 pandemic has and continues to devastate the world at a time when nearly 1 billion people are still hungry. In sub-Saharan Africa, there are nearly 240 million people that are undernourished. Superimposed on this malnutrition crisis is the COVID-19 crisis. Worryingly, COVID-19 is not just a medical crisis, it is an economic crisis. It's also a social crisis with important negative externalities on nutrition. Asked elsewhere, but also relevant in our context, is the question of how the world is responding to the COVID-19 pandemic. Today, we will focus on Africa. Our question would be, how is Africa responding to COVID-19? Specifically, what are the nature of Africa's nutrition emergency response to COVID-19? What are the immediate and medium-term as well as long-term impact of COVID-19 on food poverty and nutrition outcomes? Are Africa's COVID-19 countermeasures social protection friendly? We would not overlook the opportunities that this crisis presents to the continent, and therefore, we will have one of our experts exploring COVID-19 and research opportunities in today's webinar. These are important issues to us at the African Nutrition Society, but also to our partners, the Food and Agriculture Organization of the United Nations, FAO, the International Union of Nutritional Sciences, IUNS, AU, ANH, that is Agricultural Nutrition and Health Academy, and several others. We have thus assembled experts from within Africa and from the diaspora to address these important issues. We hope that the webinar would contribute to the discourses and guidance that are needed to improve food systems in Africa in the face of COVID-19 pandemic, and also address the lingering question of food insecurity in Africa. We will endeavor to disseminate the various output that would come from this webinar, but also ensure that it gets to the desk of continental decision makers, some of whom are present today, and you would be hearing from them soon. If you just bear with me for a few more minutes to introduce our partners. First, the African Nutrition Society. Established over a decade ago, the African Nutrition Society, among others, aims to provide a professional scientific forum and voice for Africa's nutrition and health, which it has done through various avenues, one of which is Biennial Africa Nutrition Conference, popularly referred to as ANH. And since 2016, we have, as a society, been implementing a 10-point plan, including, for example, strengthening our partnerships with other learned societies and federations across all regions of the world, like the IUNS, the ANH, as I noted earlier. Cementing our partnerships with international organizations, including United Nations agencies and other organizations desirous of building intellectual capacity and promotion of the field of nutrition in Africa. Ethically engaging with private sector as we all work collectively towards the realization of local, regional, and nutrition goals, and implementing inter-ANH lectures for continued engagement with our members and stakeholders in between our biennial conference. What we are doing today qualifies as an inter-ANH activity. We get all these things done in partnership with others, like the ANH. Talking of ANH, I'm very glad to say that when this event became oversubscribed, the ANH Academy offered us a bigger and better platform to facilitate greater participation. In case you didn't know who they are, the Agricultural Nutrition and Health Academy is a global network of researchers, practitioners, and policymakers working on agriculture and food systems for improved nutrition and health, with members in over 100 countries. Joining the Academy is free of charge, and so I would encourage you to do so. ANS has partnered with the Academy for several years through joint delivery of webinars like we are doing today, and also supporting their Academy Week, which is a 5-day event of interactive learning labs and research conference. It rotates between Africa and Asia every year. This year's Academy was scheduled to take place in Lilongwe, Malawi. However, due to COVID-19, it is going to take place virtually. And so, as I've noticed, I encourage you to log onto their website, if you can see from my screen here, and then join. The conference is hashtagged ANH 2020. And to our third partner, the International Union of Nutritional Sciences, if Alfredo is here, please go ahead and present your society. Is Alfredo in, Francis?
No, I can't see him, but I can speak for the IUNS. The IUNS
Please go ahead.
Is the overarching scientific organization for nutrition globally. The IUNS has a mission to promote the advancements of nutritional science, research, and development through the international cooperation at the global level. Now, we encourage communication and collaboration among nutritional scientists, as well as to disseminate information in nutritional sciences.
Sorry, can I enter now? Can I enter now?
Okay, good. So Alfredo is here. Francis?
Alfredo.
Should we backtrack?
Sorry, I have some problem with but I have seen another slide this morning. Can I use other slides?
Yeah,
okay,
sure.
Yes, the slides are already projected, so please go ahead, if you can see the slides.
Yes, but really I use another set of slides, not this one.
Okay, then that is fine. So let me stop my screen sharing, and you can share your screen and present. Is that okay?
I will try that. Okay, thank you.
Yes.
So please go ahead.
Okay. Can you see my slide? Can you see my slide?
Not yet. Can you press the share screen?
Okay, share screen, and then you can locate the screen from the slides from your computer. So down, you see share screen with a green arrow pointing up. You click on it, you can locate your slides from your computer. Okay, so
can you watch now?
We still can't see your slides. In the interest of time, can I project what I had earlier, and then you can speak to them?
Okay, no, I did some slide specifically for this, but can you just watch now?
Okay. Okay, I think, yes, we can see it now. Yes, please go ahead.
Thank you very much. Thank you very much.
Okay.
Okay, can you watch now?
Yes, please go ahead.
Okay, sorry about that, but I had problem with the compatibility. Thank you very much to the organizer to give me the opportunity to present some data related to ANS. Thank you very much. As you know, ANS has some priorities, and in this case, we have a vision of COVID-19. Is to live a life without malnutrition is a fundamental human right, and the presence of malnutrition is immoral. Also, the vision from ANH related to COVID-19 is that nutrition improvement anywhere in the world is not selective, societal, or an individual need. The actions that we have in UNES is attention to a very and affiliated societies, African society, to promote education and online courses, implement task force to prepare documents of interest in relation with the private sector, the grant seeking, guidelines for customer, and ICNS in Japan Congress. All of you are invited. But what are the focus I want to give to ANS and COVID-19? Indeed, nutritionists have a role in nutritional information. First of all, in assessment, it's important to know the underlying status to implement any. One, in interaction of ANS with COVID, is to promote personalized nutrition care, either of patients with COVID-19 or through hospitalized patients. So, the point is to elaborate precision recommendation, energy, macronutrients, micronutrients, fluids, and nutritional supplements. Finally, I mention that African Nutrition Society, in collaboration with ANS, have a role in giving importance to interdisciplinary actions. Indeed, there are in mathematics and computing science, including biomathematics, action in physics and chemical science, but of course, there are actions in food science, in biology, microbiological science, and in medical nutritional science. Also, nutritionists, scientists related to nutrition, important in medical health science, all in socioeconomic science. This words, I don't know if you plan that I can just give a picture to this or go ahead conference. Thank you very much, and sorry for the connection at the beginning. Thank you very much. Any comments? Any ideas?
Hello, it seems like Amos La is muted. Are you here, Amos? Because Amos.
Amos.
Okay. I think Amos is lost. I think, Paul, can you kindly take over and we
Hello? Hello?
Amos.
Yes, Amos.
Yeah. Can you hear me?
Yes, please.
Yes, we can hear you. Yeah.
Thank you. So thank you, Alfredo. I was just sorry about that. So my mic was muted. The line wasn't good, probably because the video was on. So I think maybe speakers, if you begin and there are challenges with audibility, you may just turn your video off.
Okay, then do you want that I repeat the last two slides? Would you like that I repeat the last two slides?
I think that is fine. We managed to hear what you presented.
Okay, thank you.
Okay, thank you. Okay, so we would continue with the introductory remarks. And so moving to our partners, the other African the African Union Development Agency. The mission of AUDA NEPAD is to foster the development of the continent through effective integrated planning, coordination of Agenda 2063 with member states, regional economic communities, and Pan-African institutions by leveraging partnerships and technical cooperation. And to FAO, it needs no introduction. So the Food and Agriculture Organization of the United Nations is a specialized agency of UN that leads international effort to defeat hunger. Their goal is to achieve food security for all and make sure that people have regular access to enough high quality food to lead active and healthy lives. So now back to the webinar agenda. Over 2.5 hours, this webinar is organized into 3 parts. We are going to have 5 speakers address 4 topics, and following their presentations, we would have 4 discussants respond to the presentations of the 5 speakers. And then following that, we would open up to all of you participants. We are aware some of you have direct country level experiences to bring to bear to this webinar. And so without much ado, let me go ahead and introduce the first 2 sets of speakers. So Muzi, you can go ahead and then share your screen. Muzi Sukati is a senior nutrition and food system officer at FAO Regional Office for Africa, based here in Accra, Ghana. He is also the acting FAO representative in Benin and Togo. He is an economist and veterinary doctor by training. Before joining FAO, he was a senior policy officer for African Union based in Nairobi, Kenya. And he's going to be co-presenting with Bibi Gersi. Bibi Gersi is a senior nutrition and food system officer for policy and programs in the Nutrition and Food System Division of FAO, but currently on secondment to the African Union Development Agency, AUDA NEPAD, the special advisor to the CAO since 2018. Her work focuses on mainstreaming nutrition into agriculture and related sectoral development agendas, and to promote multi-sectoral approach to addressing all forms of malnutrition. She holds a Master of Science degree in International Nutrition from Cornell University, New York. She has served on numerous international scientific technical committees and policy advisory boards. And so participants, I hand over the mic now to Muzi and Bibi. Please go ahead, Muzi.
Okay, thank you so much. Thank you so much, Amos, for the introduction. And I hope colleagues can hear me and they can see my screen. First of all, I would like to thank the organizers of this very, very important event, webinar, to just touch base with colleagues and to get input on what strategies we can come up with as nutrition people, as other stakeholders to fight the unfortunate situation of the COVID. For me, for us as FAO, we will be presenting based on the food systems approach. We know that if we're talking nutrition, we are talking food, definitely. So the Food and Agriculture Organization matches the crisis is a health crisis for now. It will definitely spill over to food systems, and besides, the importance of food is critical for nutrition, for fighting this unfortunate outbreak. So I'll go to the next slide. So as I have seen, the COVID is not just a health problem. We know it has all these other spillovers, negative outcomes, including the economy. We know what is happening in countries. Schools are being closed. People are being laid off from work. The economies have taken a dive, and we are going to be seeing a lot of increase in poverty, reduction in household income. So all these mechanisms that are happening will have an impact on household nutrition and food security, definitely. So unfortunately, this outbreak is happening at a time when the sub-Saharan Africa region is still struggling with high levels of undernourishment. Amos has clearly said in his opening remarks that we still have about 240 million people that are going hungry every day. And Africa has the highest level of insecurity of about 27% using the food insecurity experience scale. I would kindly like to explain that the food insecurity experience scale is one of the indicators of towards the sustainable development goals of 2030. And I will kindly encourage colleagues and nutrition officers to probably to read about it and see what it is, because countries will be expected to report in 2030 on these indicators, and also the indicator of prevalence of undernourishment, which FAO had been given the custodian to track these indicators. Not just FAO has to work to ensure that the targets are met, but to track as custodian. We know that to achieve the targets, we will have to work as teams. Everyone is involved. So the continent is still struggling with stunting. We know the statistics, the anemia, and besides all these disturbing statistics, we know that these outbreaks are happening in unfortunate times of issues of climate change, reduction in agricultural productivity, and other shocks, including we know very well what is happening in East Africa, the unfortunate desert locust, which is ravaging that continent. So there are so many problems that are interlinked. So what we are seeing here, this graph is just showing the trend of some of the nutrition indicators vis-a-vis the gross domestic product increase rates. So we see that the trends, many of the indicators of malnutrition were going down, even though the lines were not are not as steep as we would like them to be, you know, because in 2020, in 2020, I mean in 2030, in 2025, we are saying there should be zero hunger, eliminating hunger, depending on whether we are UN or the African Union, we work as teams. So, but what we are seeing now is that the COVID-19, because of the emergency responses that countries have taken, it will just hit on the economy. Whether we are working in a steel industry, we are working in the transport sector, it will just reduce household income. So what we know for sure is that there will be a kink going forward in these lines. I mean, going upwards in this line. In these lines, they were going down, the undernourishment statistics, but because of this shock, we are expecting a kink that it will increase going up. The rate of the increase going up will depend on the impact of the virus, which we still don't know yet its full impact, and of course, our interventions as nutrition people, as food systems people, as health experts to help alleviate the situation. So these are some of the things that I was trying to say. There will be a COVID outbreak. It's spilling over to the economies. The countries the economic activity has slowed. It will definitely spill over into the food markets. We are already seeing this, the informal trade, disruptions, increased food prices, reducing household income, and all these things will end up spilling over to fueling malnutrition at household level. So this is just a slide that shows that what we mean by food systems. By food systems, we mean the food environment. So it involves a lot of things, the drivers of the food systems, the climate change, your shocks, population growth, they all work within these food systems. It talks to food storage. We know, like there are issues of post-harvest loss, trade and retail. So it's a big environment, which also spill over to also the biodiversity and protection of environment. So this is a system, whether it's speaking to fisheries, oceans, etc. So what we're trying to say is that when we are looking at food systems and nutrition, we have to look at the bigger picture, you know, because all these things are driving what people will end up doing. Will it be sustainable? going forward. So when we do preliminary analysis using the GDP per capita growth rate and regressing it to the malnutrition statistics, especially using the prevalence of undernourishment, we are estimating that preliminary estimation that if countries go into a recession of probably -1%, which is a moderate recession, we are expecting that a -1% recession will throw 30 million more people into hunger in the continent. So we see that we look at the bigger picture, looking at the economy at large. It's because the agricultural systems has got so many spillovers, you know, like some countries, for example, are not producing any food because they are just concentrating on exporting oil and importing food. So we know very well that because of the recession, economic activity has slumped, the prices of oil have dived, the countries will not have enough money to import food, to provide social security. So these are the things that we need to be looking at. So we can, from our analysis as well, we can say that the relationship between the GDP growth rate and the malnutrition indicators is not very strong. So we are saying that direct intervention will be more critical. You know, we use data, we target the people who are really in need of intervention, and we go there because we know that GDP growth rate is a crude indicator of how a country is progressing towards improving its economy. But we know very well that the economies of many countries are skewed. You know, some people have got too much, some people have nothing. So it doesn't mean that if the economy of the country is growing, people are getting better off. There are people who are being left behind because of policies and things like that. We know all these things. So what are the key messages that we are having? The key messages are that definitely the COVID-19 will worsen the malnutrition statistics and will affect our trajectory towards the ending hunger or zero hunger of the African Union or the SDG indicator of 2030. So it is important, as we know very well, that when the outbreak came, the trend was, okay, let's save lives. So there was the shutting down, economic shutting down, but we know very well that the system is not sustainable. It is important to save lives, but livelihoods need to go on. So we are saying that as nutrition experts, food systems experts, it is important to do country level analysis and target the poor and the most vulnerable people in trying to alleviate the impact of this project. Without that, we will be missing the people who really need the support. Farmers need to be supported to increase their productivity, reduce post-harvest loss, and access to market. So what you are saying here as FAO is that it is critical to target short value chains. What do we mean by short value chains? I will give you an example of the shortest value chain. If you are promoting a household garden, the people will be just doing the farming, gardening something, taking it from the garden straight into the kitchen and cooking it. So that is a very, very short direct value chain that has a lot of impact on nutrition. Even though, well, it can be argued that a short value chain doesn't promote employment creation along the value chains, because probably if the value chain was long, there will be people who will be working, transporting the food, packaging it, and the advertising and all these things, you know. So, but at the end of the day, the longer the value chain, the higher the price that the consumer will end up paying at the end. So in economics, they say that a price of a commodity has everything about that commodity. The stages it has gone through, the policies it has passed through. So you just have to monitor the price, you know everything that is happening about that commodity. So, but you are saying short value chains at this emergency time are critical because they are a form of direct intervention. So we are saying they are also need to strengthen food reserves, because as you know that if crises happen like this, countries are saying, okay, let us protect our people first, you know. So what about the countries that do not have the capacity to preserve food. So, and the last thing is that the joint effort is critical. The way we will win this outbreak, it's not working as individuals, people using their skills and whatever they say. It's a collective effort in resources mobilization, in formulation of policies, in creating synergies, and preservation of resources that we have through sharing them. So these are some of the nutritional interventions that we have. I am sure my colleague Bibi will talk about it at the medical intervention, which are critical. And we are also saying that it is very, very important to support countries with the messaging of what food of nutritional value they can eat. That is affordable at the local level. And at FAO, we have these very important tools called the food-based dietary guidelines. So those dietary guidelines can help nations to prioritize the cheap food of high nutritional value that are available on local markets. We know that because of cultural differences, some countries prefer certain kinds of food versus others. So these food-based dietary guidelines are specific to a certain nation vis-a-vis their comparative advantage in producing that kind of food, and of course their cultural preferences. So I think this is the last slide. Well, these are some of the government interventions. I will not go through them. We can share the presentation with colleagues. So there are so many other areas of work: school feeding and social safety nets, promoting social safety nets, supporting countries to give grants to poor families. We know that a lot of countries are distributing food parcels. So these are areas where we need to be supporting the countries, making sure that these food parcels are sourced from preferably local farmers so that they also increase their income. I thank you very much.
Yes, is Bibi showing her screen? Is she going to project hers?
I'm trying to see if I can project.
Okay,
if I
good.
cannot, bear with me. I'll just see if the slides will be available.
Okay.
Or if Muzi, on the other hand, he has my slides, just so
Okay.
that I don't waste time, he can project them. Thank you very much, colleagues. Good morning, everyone, and thank you, Muzi, for kicking off the presentation and sharing. My presentation is going to be very brief. I'd just like to pick up from where Muzi left to highlight some of the things that AUC, NEPAD, as well as the regional economic communities, including the member states, are doing at this point. We have to understand naturally that when the COVID was announced as far back as in January, Africa actually was one of the continents that were in the forefront of taking immediate action. Unfortunately, with the lockdowns, it was very clear that the impact, as Muzi noted, was not only going to be from the health front, but also from the basic socioeconomic and other aspects, education included. So now, we need to understand the fact that we are not starting from ground zero. There actually has been quite a lot that has been done by not just the regional economic communities, but also the member states in terms of them developing their own response plans while looking at what already exists. And most importantly, learning from lessons from before. Now, we go to the next slide, please. Indeed, the response areas for AUDA and AUC include the health systems, because this pandemic has been immediately understood as a health pandemic, even though that is not entirely true. Fortunately, food security and nutrition, food systems as a whole, which we know are broken, are one of the priorities. And developing skills and employment and ensuring that the youth actually are engaged, and looking at the education factors and the fact that right now schools are closed. Those people that were relying only on the school meal do not have access to that? How do governments and their systems become nimble so that they can restructure the way they've provided those social package programs? And of course, you know, we talk about data systems and how weak they are. So this is one area that in terms of planning and data generation and management, the governments are doing. Tourism, of course, but these are all embedded in the Malabo 2025 Zero Hunger, as well as the Agenda 2063, as mentioned by Amos in the introduction. Now, let's quickly understand the fact that countries, regions across Africa are at different levels of contact, different levels of coordination, as I mentioned in the governance, different levels of their own coherence in terms of policy design and program design and program implementation, more importantly. But monitoring and evaluation remains a critical element of this. Now, these are some of the instruments that have already been produced at the level of AUDA, NEPAD, as well as AUC. And now we are also saying, let us draw some lessons from the past. What did we learn from HIV/AIDS? A lot was learned. In the beginning, nutrition was not considered in addressing HIV/AIDS. But then, as time went, we recognized that indeed, prevention of HIV/AIDS and mitigating HIV/AIDS, nutrition is actually at the heart of the issue. Now, we can lament challenges and the impact of COVID, as Muzi eloquently alluded to, and Amos as well. There will always be challenges, but we can always also flip the challenges to turn them into opportunities. But very clearly, COVID has disrupted systems and sectors. It has also exposed the fault lines that already exist within societies in terms of the inequalities and in terms of the iniquities. Those that are already vulnerable are actually more exposed to getting the virus. But then again, we can say COVID has been a leveling pandemic in that everybody is actually vulnerable. Everybody can get it. But more importantly also, COVID has exposed the fact that where governments have been weak, the structures were not working and there were dysfunctionalities. It's just exposed and made it worse. And it has exacerbated malnutrition in all its forms. And then Rex were also saying that suffering from the non-uniformity of guidelines, data limitations, and the limited resources, particularly for addressing nutrition concretely. Next slide, please. Next slide, Muzi. Okay, now we can literally look at COVID as an opportunity that is going to provide us with immediate and lasting solutions. First, what are the RECs doing? They're already strengthening the research, data collection, and revamping their early warning systems and disaster preparedness. They're also working on improving knowledge products for guidance. We are working on that with the RECs for guidance to countries. And we're also building the required capacities across sectors and cadres. As I've been listening to the news, it's clear that medical doctors, nurses, and other frontline workers do not know specifically what to do in terms of nutrition. And then there's opportunity to engage more with the task force that has been set up at continental level. One, to mobilize resources, and two, to understand what actions are required. We should not forget the private sector. The private sector actually has been the one at the forefront of providing food parcels in a lot of cases, engaging with the whole value chain line to make sure that the farmers, the supermarkets, or the market ladies are engaged in some kind of support for COVID. Those that have
Bibi, Bibi, are you getting to
I'm done.
Okay, good.
Yes, I'm actually done. So then expanding, interestingly, the technologies, specifically Commercial reported on this, that they are actually reporting on expanding digital technologies for clearance of goods at the borders. And then, of course, communication and collaboration. And I think, folks, that's it. Thank you very much.
Thank you, Bibi. Professor Amuna, please get ready to share your slides whilst I introduce you. So, Prof. Amuna, please go ahead and share your slides. Professor Muna is a physician scientist and a public health nutritionist. He is a leader in the African and global nutrition community and has worked in Europe, the Arab Gulf, and Africa. He is currently Dean, School of Public Health at the University of Health and Allied Sciences here in Ghana. So, Prof. Muna, if you are ready, go ahead and then share your slides and do your presentation. Hello, Paul. Hello, Paul. Francis. Hello, Paul. Okay. We may have lost Paul. So I start to Jalo. Is it okay if you do your presentations whilst we wait for Paul to join?
I could.
Okay. So
yeah.
I'll go ahead.
Okay.
Oh, Paul. Oh,
yeah.
Sorry. Paul is here. So Paul, please go ahead. You've been introduced.
Okay,
go ahead.
Thank you. I was muted and I couldn't share my slides.
Okay.
It still tells me that I cannot share my slides. Can somebody do something?
Abel, can you make Paul host? Is he still host?
Yes, Paul is a co-host now, so you will be able to share your screen.
Okay, please go ahead, Paul.
Okay, thank you. I think it's because I went off briefly. Okay, so can you all see my screen?
Yes.
Okay. All right. So thank you all very much. And I think, as has been said already, this is a very important webinar, a very important forum for us in the food, nutrition, and agriculture area to actually dialogue on how we as professionals and people working in programming and FAO and others in the research community should be looking at our contribution to what's going on. And just to put it, in context, I hope to just look at a few things relating to the COVID predictions for Africa, what the current situation is, and to look at some of the impact, and then to come up with some suggestions as to how we move forward. So in February, we had our first 2 cases of COVID, both imported, and they were in Egypt and Algeria. And at that time, the WHO Regional Director for Africa actually warned that the window of opportunity for the continent was actually closing, and that all countries must ramp up their preparedness activities. And I think in BB's presentation, she has already told us about some of the actions and measures that were adopted by countries at different levels of strength. And I believe to a very large extent, those actions have actually made a difference in terms of how this whole pandemic has been evolving in Africa. And by April, we had 21,000 cases, and WHO actually predicted that if trends continued unabated, then Africa could become the epicenter of the disease with over 300,000 deaths, and that, as Muzi mentioned earlier on, 30 million people could be put into poverty. Now, what is important about today's discussion is that much as a lot of the focus on debates in the media, on television, and other areas has been on the general health and economic impact and responses, we need a platform for nutrition and food security dialogue and provisions in Africa. And I think this forum is the most appropriate one for us. Now, in terms of current situation, as at 30th of May, we had over 136,000 cases with just under 4,000 deaths from COVID in Africa. And in fact, Africa's COVID contribution to the pandemic is just about 1.5% of the global total. And Africa's death rate from COVID is about 0.1%. So you can say that to a very large extent, Africa has been spared all the things that were predicted and what have you. And in terms of the distribution across countries, we have levels as low as 2 that have been reported in countries like Lesotho, and levels as high as 29,000 and getting closer to 30,000 reported in South Africa. And Egypt has also had a very high hit in terms of numbers, over 22,000. Other countries with relatively high and creeping high levels include Nigeria, Algeria, Ghana, Morocco, Cameroon, and Sudan. And what is interesting is that much as the levels in Africa have been very, very low, and you can see in countries like Gambia where they have about 25 cases reported and so on and so forth, you also find that despite the low levels, the impact in terms of economic impact has been well in excess of what you would expect for such low numbers of disease in a global pandemic. And that is where I think the issues are. For example, it was predicted that we're going to have high numbers and that our fragile health systems, as have been mentioned, will not be able to cope, and that we lack access to preventive measures and so on and so forth. And those issues about testing and barriers to testing and so on and so forth. And then the vulnerable groups that we have in terms of poverty, in terms of weak systems, all were going to come to bear. But then somehow this has not yet borne out. However, it is predicted that over 60 billion economic loss would occur. And as Muzi said in his presentation, there is going to be a negative growth GDP of -1%, which is clearly a recession. And in many countries, there is a drop of economic forecast of between 6 and 10%. And so, groups like the Africa Development Bank, the World Bank made provision for support for countries. And within the AU system, as Vivi has already mentioned, there were quite a number of meetings, and a meeting of agricultural and food ministers with the AUC, Rural Economy and Agric Department, and the FAO actually sat down to look at some of the impact of COVID, for example, on things that I think Muzi has already mentioned, on mobility, non-COVID health services, and then exacerbation of the challenges of drought and locust and armyworm, particularly in the eastern parts of Africa, which has been going on since about late November, October, November last year. And therefore, COVID has come to actually add to the problems there. And then the impact of a decline in the demand and production of food from economically developed countries who are now thinking more about how to actually deal with their own problems. And then, of course, a global recession, which we know we are now in. And it is said that since the global depression of the 1930s, this is the worst economic scenario that we have. And if you take countries like Kenya, where exports of horticultural products like flowers actually is a major source of earnings, you find that at least $1.6 billion losses just to that sector alone has been forecasted. And then, of course, our tourism and so on and so forth, and the impact on other sectors, industries like meat and fish and dairy products. So when you look, you find that one of the other things that we have seen with COVID has been that because of reductions in interregional transport and trade, the impact, particularly on food supplies across borders, has been striking. And then there have been food shortages with price hikes and so on and so forth. And because to a large extent, we lack the cash savings that others have the luxury of having, food poverty, and particularly urban poverty is now a real issue. So what are some of the things that we need to think about when we're looking at COVID and Africa? About 71% of Africans work in the informal sector with no financial means outside of what they do on a daily basis. The food and agri systems in Africa are highly labor intensive, and shortages of labor due to the restrictions of movement across regions and across districts is a major challenge. And then, of course, disruption of the food supply and agri systems, which have been mentioned by the previous two speakers, and then livelihoods and food security issues that are a big problem. So it is very clear that COVID has impact on a whole lot of things, including movement of people internally and so on and so forth. But at the same time, we know that without these measures, it is going to be difficult for us to actually stem the tide and get Africa out of this global pandemic. Because movement of people now, particularly internal movement, because we are no longer importing cases from outside because of restrictions in air travel, transport and non-observance of public health containment measures, public spaces and clustering areas such as open markets. We have seen outbreaks in various countries across Africa and in India and places like that, where fruit and vegetable markets have been a source. Fish and meat processing factories, we've seen major outbreaks in the US. Recently in Ghana, over 600 cases were actually reported from one factory alone. And then, of course, rail, construction, and oil industry, and churches, and so on and so forth. And then in schools, as we contemplate the reopening of our schools and getting the children back so that the school feeding program can support the vulnerable. So what are some of the immediate issues that we are facing? That there is a drop in foreign direct investment in many ways, and then there is sudden loss of incomes, lack of purchasing power and food availability, as I've mentioned. And as a result of all these, even the giving goods, so-called giving goods, the goods that usually the poor tend to go for under normal circumstances, that you find people buying only when there is desperate need, such as cassava flour that is used to be very cheap. Suddenly the prices of these maize meal have gone up. And then we've seen a drastic reduction in non-COVID related health service utilization. Maternal reproductive health antenatal attendance has dropped up to about 35% or more in certain areas. In fact, in some areas they report over 75% drop. Postnatal attendance, child welfare, and immunization. And it has been predicted by WHO that up to 80 million children under 1 year are likely to be affected by lack of immunization as a result of COVID. So these are really stark numbers. And of course, there is an increase in the numbers of severely malnourished and those with micronutrient deficiency. And in Alfredo's presentation about IUNS, he did mention the fact that IUNS is very keen on these various areas relating to food intake, energy, and other nutrients, micronutrients, and so on and so forth. He also did mention the fact that we needed to undertake nutritional assessment. Why did he say that? It is because we need to be able to measure the impact of COVID on nutritional status. And I think I want to emphasize the important role of the food programs in our schools, which Didi mentioned, which are now sort of a problem because the children are now home, and therefore those who had at least one full meal at school, which was a major source of food and energy, now the question is, how do we meet their needs? And then, of course, there is decreased food production, and as I've mentioned, this is going to be a problem. Not only that, but even where there is food, particularly vegetables and fruits and perishable goods and tubers, because they cannot be moved to the urban centers, to the open markets because of the restriction in transport and movement, these are getting rotten, there are food losses and waste that are taking place. The question is, how do we address these issues at national level, and how do we as professionals actually help with this? And poor food supply will affect especially the urban poor. We have seen protests across various cities, and in Malawi, for example, people had to take the government to court, and the government had to promise to actually provide monies to support 172,000 households that were on the lower end. And I believe Isa too will be talking about issues around social protection, and probably will address some of these issues. Now, the question is that our health resilience is under threat, and the other speakers have mentioned this. We are concerned about an increasing level of maternal undernutrition and low birth weight. And only yesterday in Ghana, it was reported that there have been 47 cases of neonatal jaundice in one regional hospital alone over the last 4 to 5 months. 47 cases of neonatal jaundice, of which 7 have so far died. These are things that normally should not happen, but we are seeing it in this era. And of course, other important issues include increased unevenness in the distribution of food within the household, limited food access, reduced daily food intake, which will lead to undernutrition, increasing levels and cases of severe acute malnutrition, macronutrient deficiencies, and increased consumption of high calorie, high fat processed foods, which when coupled with the reduced level of physical activity because of restrictions of movement, are also likely to affect the other side of malnutrition, which is childhood obesity. So these are real stark happenings now. And so what are our roles? One, we need to be directly or indirectly involved at country level as professionals in terms of technical advice, in terms of helping with policy, in terms of being involved in the actions that are taking place nationally. We need to be more proactive in terms of advocacy and communication. And we need more webinars of this kind to come back and see how well we are doing in terms of our contribution to this whole area. We need to stand up and be counted as food and nutrition professionals in Africa. Data gathering across a range of areas. And BB has mentioned some of the strategies that have been adopted, but I think for us, it is very important that we as scientists and practitioners should begin to actually design and to start collecting data so that post-COVID, we will know where we were and how it has impacted. This is very, very important in terms of mapping of food distribution and access, in terms of nutritional and health assessment, as Alfredo mentioned earlier, in terms of non-COVID health services and their impact, particularly on child welfare, immunization, severe acute malnutrition, and so on and so forth. And then, of course, we need to look at food poverty and impact on livelihoods, and look at the indicators of progress towards ending hunger by 2025, which is a key goal of the Africa Union. And how is COVID impacting on nutritional status and attainment of the Sustainable Development Goals? Africa is making good progress along these lines. Africa has been moving on the up in terms of stunting, in terms of underweight and so on. And now we have this. And the question is, how far is it going to go? Because there's a clear likelihood of a recession, and that is probably going to last at least for the next 18 months to 2 years. And the question is, how do we address this? So what are some of the actions that we need to take?
So
first of all,
Paul, I hope you are getting towards the...
This is my last slide.
Thank you.
Yes. So Africa has the lowest COVID cases, but the growth exponential and the economic and food security implications are grossly disproportionate. We need to look at ways of addressing the numbers of malnourished. We need to look at poverty reduction strategies. We need to look at mapping and accurate recording of the most vulnerable within our populations, and also for future targeting. We need to prioritize food and agriculture sector as essential, and that must be supported to function even in times of crisis like these. And we need to look at food and nutrition agriculture as professionals, our roles, including how we actually undertake research, to provide data on food, nutrition, and the impact of COVID-19. I thank you very much.
Thank you very much, Paul. And so, Isa Tijalo, if you are still here, please get ready to share your screen and do your presentation. Whilst you do that, just a quick announcement. As noted earlier, we recognize that some of you are on the ground and would have direct country level experiences to share. And so we have dedicated some good amount of time for our open forum. So just hold your guns in terms of contributing with the mics. However, you can post your questions using the chat box. Some of you have already posted, and we will ensure that all those questions, or most of those questions, get to the presenters. They would address them. So either post your questions through the chat box or wait to the open forum, and then once you raise your hands, we will try to reach you. Thank you. And now to Aisha Jallo. She is a global nutrition leader and advocate working across sectors and stakeholders to put nutrition and women at the center of development. Her career spans across nutrition, health, food security, and gender, with extensive leadership policy and implementation experiences. Previous positions held by her include Chief Women, Children, and Gender at the United Nations World Food Programme, Senior Nutrition and Partnership Advisor at AU Nepal, and Executive Director of National Nutrition Agency, NANA, in the Gambia. She is currently the Executive Director of African, that's Africa Catalyzing Action for Nutrition Network. Aisha Tijalo, please go ahead with your presentation.
Thank you very much. And it is a privilege for me to be part of this group and participating in this webinar. And my thanks to previous speakers, Muzi, Bibi, and Paul. Paul, I could have given you half of my time because it was great listening to your presentation. Thank you. So my presentation is on COVID-19 and social protection, and previous speakers have already set the stage for what I'm about to say. So I don't think I'll take up too much time. I'm just going to give an overview of measures put in place for social protection and COVID-19 response in Africa. But first of all, I have to start with a definition as per the African Union. I know we all know the definition of social protection, but just bear with me to give you this definition. Responses by the state and society to protect citizens from risk, vulnerabilities, and deprivations. And this definition is from the Social Policy Framework for Africa from 2008. Now, since we're going to talk about social protection, we have to look at the state of social protection in Africa. And last year, the UNDP, in collaboration with the African Union and other partners, actually looked at the state of social protection, which is becoming increasingly important. In 2000, no African country had a national social protection strategy or policy. By 2010, only 4 countries had one. But by 2017, more than half of all the countries on the continent, 29 countries, had either a strategy or a policy. What is the situation today? It's one thing to have a policy, but there are countries who, even if they don't have policies, do have programs in place. And as of today, it may be more, but from what I know, more than 45 countries now have social safety net programs in place. And this is to address chronic poverty and to help poor households diversify their livelihoods and invest in their children's health and education. However, some of the social safety net programs cover only a small proportion, and some are concentrated mostly in the rural areas where, of course, we have chronic poverty. But you've listened to the other speakers, the urban poor, that's a problem that is not going away, and we have to address poverty at a global level. Also, I think the previous speaker talked about 71% engaged in the informal sector. What I have here is 8 out of 10 people are engaged in formal employment. That's World Bank data. So, with more than 45 African countries having social safety net programs in place, there is an opportunity to build on and expand coverage, improve targeting, strengthen monitoring, and enhance accountability in the midst of the pandemic. Now the commitment. This was already mentioned by Paul, and this is important. Coming in the midst of the pandemic, we have a commitment again from the agriculture ministers, from the agriculture sector to health, food, and nutrition security. And that's why it's so important to highlight this. And they have committed to ensure that, ensuring that measures are in place to support the food security and nutrition for all. That's important, but especially for the most vulnerable segment of our populations. And another commitment is to provide adequate safety nets, including cash, food, and other relevant social protection measures to support all vulnerable population groups. Now, I have this quote: people should not have to choose between death by COVID-19 or by hunger. And the reason why I have it is because this was a quote that was made by a head of state, the president of Togo. There was an article he had in the Financial Times. And this was also a quote made by so many people across the board, people from the informal sector, mothers, fathers, right across the board. Because of the lockdown, people having to stay home and being part of the informal sector, saying we either have to go out to get an income, or if we choose to stay home because of the lockdown, then we are choosing between death by COVID-19 or by hunger. It is a hard choice, and nobody should have to choose between these two choices. Now the action. This information is as of May 13th, and it was collated by the UNDP Africa Office with information from the World Bank and other sources. These are the social protection measures in sub-Saharan Africa. Now, if you look at it, social assistance takes up over 50%. Then you have social insurance, 18%. Private sector initiatives. The importance of the private sector was mentioned earlier, I think by Bibi, 12%. The labor market programs, 8%. And most importantly, community-based initiatives, because community-based initiatives are important if you're looking for sustainability and also targeting and getting the right people, the people most in need of support. Now, the social assistance types, this is a breakdown of the social assistance types. And we can see that when it comes to cash transfers and other financial support, that takes up most of the social assistance types. We have in-kind transfers, of course, utility and tax relief support, support to informal workers, school feeding, and public works. This is also, I'm bringing another quote from the president of Togo, because what he says is that mobile cash is the best way to help Africa fight COVID-19. And without it, lockdown informal workers, again, face death by disease or hunger. It was interesting to get this quote. Women will receive the highest possible payouts as they are more directly involved in nurturing the entire household. And that is so true. So if we look at the way Africa is addressing the situation, we are definitely on the right track. Building on what we have and moving it some steps further. And the fact that agriculture is really looking at nutrition. This is something, as nutritionists, we've been very, very concerned over the years, but we're here and agriculture is looking at nutrition and is committed to nutrition. So cash transfers and other financial support. These are the countries as of May 13. I have about 27 countries here and I won't go through them. But in addition, we also have Algeria, we have Egypt, we have Tunisia, we have Morocco. And all of them are doing cash transfers and other financial support. And cash financial support, financial support is important because in addition to the potential of improving nutrition, it also helps the economy and increases spending at a time when spending can be really low and can affect the economy. So moving forward, social protection. How can we strengthen the social protection and nutrition nexus? Because there's so many messages that can be under this section of moving forward, but it's been done so well by Paul and the other speakers before me. So I just have some few key messages for moving forward. We have to look at social protection measures along the life cycle. We cannot just look at the adults. I know school feeding is being addressed, and children of school going age, some countries have decided to do home rations, send food to the children at home, and some have decided, some are planning or are already giving financial support to parents of children who should have been receiving school feeding, but the schools are locked down now. So that's one thing. But looking at social protection measures along the life cycle is critical. And I think it was Muzi that talked about the short value chain. And I want to make a special mention of breastfeeding mothers. I don't think there's any shorter value chain than breast milk from the producer, the mother, to the consumer, the infant. So we have to do all we can to protect these mothers. And I think that's going to come later with one of the discussants. Then learning from the past, indigenous knowledge and practices. There is so much to learn from the past, because I know that in some communities, there's an example from Zimbabwe where they actually have an indigenous food security. They're implementing an indigenous food security revival strategy at the village level. Those are the community initiatives, the indigenous initiatives that we can build on if we want to have sustainable social protection measures, not only for COVID-19, but beyond. And we also have to look now at our indigenous crops. Now is the time to really revisit our indigenous crops. Because, markets are closed. We export a lot of the foods into our countries, processed foods. Time to revisit our indigenous crops. And also time to revitalize, if we haven't already, primary health care. I think those are the points I wanted to raise moving forward. Thank you so much.
Thank you very much, Esacho. As noted earlier, so we are not overlooking some of the opportunities that COVID-19 presents to the continent. And so the final presentation in this section of the webinar would look at exploring COVID-19 and research opportunities. To do that, so Linley, if you are ready, you can go ahead and then begin sharing your slides whilst I introduce you. So to do that is Professor Linley Chiona Carlton. She holds a PhD in international health and is currently serving as associate professor at the Swedish University of Agricultural Sciences, SLU. Prior to joining SLU, she was an adjunct lecturer at the Department of Nutrition at Uppsala University and education trainer in global health at Karolinska Institute in Sweden. She served as a scientific coordinator and trainer with International Foundation for Sciences, IFS, responsible for the area of food science and nutrition. During her tenure at IFS, she convened the first ever trainer of trainers and scientific training workshops for African women in agricultural research and development, referred to as AWARD. Her expertise in capacity building is highly sought after in bilateral capacity building programs between Europe, Americas, and African universities. Linley is a fellow of the Royal Swedish Academy of Agriculture and Forestry and a trustee of the African Nutrition Society. Professor Linley, if you are ready, please go ahead.
Yes, thank you very much, Amos. Can you see my slides, and can everybody hear me well?
Yes, I can. Yes, I can see. I'm sure. Yeah, the call can see, and I can hear you. Please go ahead. Thank you.
Thank you very much. Firstly, I just wish to thank everybody that has taken the time to attend this session. It's one of our first webinars as the African Nutrition Society, and I see a lot of interesting comments coming up in the chat, and I want to thank you all. And in particular, I do want to acknowledge the person who said that we Anglophones tend to focus or limit ourselves to thinking only about the English language, and that we need to also include the Francophones, the Lusophones, and I would add even the Arabic-speaking world. So for that, we take that message home, and as you know, it's the first one, but we are looking forward to having many more. So my topic for today, I wish to thank the previous speakers, Musa, Bibi, Paul, and Aissatou. Being the last speaker, it's always very difficult to have something that is totally out of the box and that hasn't been mentioned before. But what I would like to do with my presentation is using my background and my expertise where it relates to capacity building, particularly when it comes to capacity building and higher education, and then the different skills that are required for undertaking some of these questions and problems and issues that have been raised by the respective speakers. What is it that is needed? But I'm also going to anchor this conversation around my own research and works that I've been doing and what I see COVID now gives us as an opportunity to understand or to undertake these studies more. So I title my presentation as COVID-19 Research Opportunities. Same, but different. And I do believe it was Bibi who mentioned in her presentation that we have a lot of lessons that we have learned already when we had the HIV and AIDS pandemic. And now we have another disease, which is called COVID-19. So in essence, you could say it's a bit of the same, but it's different. As the previous speakers have also mentioned, that with COVID-19, there is no individual or place on earth that has not been impacted or that will not be impacted by COVID-19. So we need to look at it as same, but also looking at it as saying this time it's different. What is it that makes it different, and how do we then address this opportunity that it presents? Of course, it's not an opportunity in the sense that nobody wants to have negative health impact, but it is an opportunity for us to delve into issues in a different way. And my presentation, So my presentation is really set in around three issues. The first one is really that we're going to have to look more to moving away from looking outward to looking inward, particularly when it comes to food preferences. Secondly, in order to do this, we're going to need more interdisciplinary studies to co-create the knowledge that should be used for informing, but also for affecting policies and actions. And thirdly, as the last presenter also pointed out, we're seeing a lot of interesting trajectories taking place when it comes to information communication technology, not least when it comes to understanding COVID, the disease itself, but also the opportunities that information communication technology can provide when it comes to nutrition. And then I'll just end up by rounding off, as our speakers have said, with some of the things that are already occurring as a result of the agreements that have been put in place by the African Union and partners. So I like to use a lot of pictures to sort of leave my point around. So when I say same, but different in terms of the context this time, it's a different disease, but it's actually pretty much what we have been seeing before. The African context, as the previous speakers have underscored, we speak much about undernutrition, but now we also have the double burden of overnutrition. We have issues around water hygiene challenges. We've discussed issues around value addition, but also post-harvest losses. And we're inundated with poverty in some of the areas and low economic growth, which is not just akin to the African context, but also globally, especially now when we have these challenges with the COVID-19. And then Africa is blessed at the same time with a very youthful population. But at the same time, it is also a double burden in terms of the youth population being quite heavily unemployed. So youth unemployment creates both an opportunity, but also it creates some challenges which need to be addressed. And we do have so much data that speaks to how female-headed households, particularly in rural areas and in areas where you have marginalization, that female-headed households tend to be poorer and tend to be more vulnerable and tend to require more support, and not least when we have these challenges, such as the COVID-19. So these are things that have been presented to you with a lot of statistics and figures to support these particular indicators. So the first thing is how we're going to be moving away from looking outward to looking inward. And I want to refer to this as looking at our food preferences. And as I said, I'm anchoring this and speaking to you, especially, I would like to speak to a very youthful population that is probably undertaking studies or is thinking about how to undertake research or is thinking about how do I, in my position or work that I have, use this opportunity to understand or provide a greater understanding and in-depth approach to how COVID-19 and nutrition should be addressed. One of the speakers indicated that when you look at the frontline service personnel, they'll tell you, we understand the disease, but how do we connect this disease to nutrition? These are key challenges where we need either the skills or we need collaboration, or we need to work in a way whereby we can understand and we can interpret and we can then act in order to address issues that are related to COVID-19 and nutritional outcomes. So the first part is the poverty and food security, which is really speaking to the Sustainable Development Goals 1 and 2. I think understanding causality is important, because without really understanding what creates what, and then how can we say there is a relationship between this particular problem and these outcomes that we're seeing in society, it is impossible to then say, this is the action that is required. So understanding causality is key in trying to address issues of poverty and food security. In addition to that, it's about understanding relationships about choice when it comes to food preferences. For example, I did quite a bit of research around cassava, and Paul mentioned that, you know, what you see are changes that with COVID-19, whereby you had cheap foods, for example, cassava, which was regarded to be the poor man's crop, which was also nutritionally very important because you could eat the leaves, the relish, you know, and you could eat the roots. either fresh or you could process them into flour. Something is happening and something has been happening. Specific to plants, you have the selection and you have the preferences. Who is it that determines which plants will be grown, which plants will be available, which varieties are around? Who is it that determines the food selection or the preferences? And in which areas? Where do we see these specific plants? Or where do we see these selections taking place? And why, most importantly? I think the question of why sometimes is not adequately answered. I remember once professor from Cameroon, whom I worked with in my training courses, he said, much of the problems we see in the studies that come out of our African academia is they're very descriptive. They don't really look at the totality and understanding and designing in order to now conclude what the causality is and why. Then the second point, which I think is very important when we're looking at research opportunities, is that we need more contextual studies, especially when it comes to the African context. And I will not delve so much into this because the speakers prior to my presentation have indicated some of the key issues that could be addressed. But I think what we need to really look into and understand more are the demographics, the spatial, the structural, the geographical, but also the economic aspects of the African context. And in that, what is the study units or the populations? Looking at it from a gender, whether it's a feminist perspective, whether it's age, it's social class, and ethnicity, and then understanding these preferences as reasoned preferences. And as you can see in the pictures I have there, you see at the bottom something that looks very interesting. For too long, we have looked at some of our food preferences, for example, the consumption of insects, as something that should be frowned upon. But now we're saying this is not something that should be frowned upon. It's actually knowledge and practices that have been overlooked and should have been given much more attention than has hitherto been given to it. And in order to understand all this, I think we need to also look more into how we're going to co-create this knowledge. And this co-creation of the knowledge will require interdisciplinary methods, and especially, I would say, a need for more anthropological studies by Africans about themselves. And I'd like to bring your attention to one particular study which I have found extremely illuminating and informative, looking at it as an African scholar. It's the studies by Elias Mandala, which is a book published in 2005. And again, we raise here an example from Malawi, and it's called The End of Chilierano. And this ethnographic food study looks at the role of networks and kinships. And I think with COVID-19, what we really see is how we have been seeing, food transfers, let it be whether it's food transfers or even the mobility of human beings or the mobility of foods, which have been related much to the networks and the kinships that exist. But we haven't been doing these types of studies. And I think this is very important if we really want to understand home economics. We've been talking, Musa and the other speakers, I think it was Bibi and Paul, is looking at how we're going to be focusing on shorter value chains. So it's like the home gardens, and then going into the household and becoming consumption. Home economics is a subject which I think has been relegated for too long into the doldrums, looked down upon and say, what are you studying in university? Oh, I'm doing a home economics. That's just about cooking food. Yes, domestic sciences. How do we cook our food? Who is it that teaches us what to eat and how to cook and how to prepare the food? We have moved on to food science, but domestic sciences is just as important. And more important is the area of dietetics. And I put there for you the definition of what is dietetics. The diet and its effects on health with the practical application of a scientific understanding of nutrition. We do not have many institutions in our African universities having the departments of dietetics. Is it perhaps time that we looked into this and reviewed how food science or nutrition or home economics or domestic science or even ethnography and food studies is brought into our curriculum, but also into our higher learnings of institutions? If you see this green picture here of these leaves, this is something which perhaps when you're walking by, you might think it's just a weed. This is a highly nutritious vegetable that grows rampantly in many parts of the African continent. But perhaps we don't know because we haven't really kept a record or imparted this knowledge to a wider part of the population. And all those pictures down below speak to the
Sorry,
need for
Lily, I'm sure
interdisciplinary.
you're getting towards the end of your presentation.
Yeah.
Lily.
So,
Okay.
and what I want to just highlight here, especially when it comes to preparation, is how even on Twitter, the vice chancellor of the University of Cape Town posted this and says, I really need help in preparing, this dish. I have bought the beans, but I don't know how to do it. Can I please get some help? And a lot of the issues that have been taken up around what do we know about our neglected foods, we really need to revisit these issues. Increasing awareness of neglected foods, particularly our legumes, grains, tubers, and then increasing our knowledge about what's available in the forest and utilization, and how do we undertake systematic reviews in order to create this evidence and share it? And as I mentioned before, the edible insects that have long been forgotten. So very low-hanging fruits that I think you could engage in. One, implicit behavior, reasoning, and behavior related to food. For example, we now know that in a publication by Curie in 2014, that we have less plant varieties available now than we had 50 years ago as a result of the selections that are being undertaken by certain groups or parts of the world that are basically governing the channels in terms of what it is that we're eating today. Secondly,
Okay.
the history of food and food cuisine, what is it that is being eaten today? And I want to just bring your attention. I'm coming to an end, Amos, in the left-hand corner. What you see happening in many parts of our urbanized societies in Africa is the taking over in terms of food preparation by a different gender, particularly when it moves out of the home and into the restaurants. And that is also changing what we are eating. And how can policy intervene to avoid negative societal outcomes as these changes are occurring? Thirdly, the geopolitical environment is changing the educational landscapes, including nutrition. We need to have a platform for co-creating knowledge, particularly when it comes to graduate and postgraduate education. What has happened to our students during the COVID-19 and going forward? I just wanted to end up with this illustrative example. I know that ISA2 in a mobile cash transfers, particularly how they have been very instrumental in giving provisions to women-headed households. Now, in this figure here, this is data that just came out in The Economist, 28th of May, 2020. What's interesting, ISA2, is that in your presentation, you listed the number of countries that have had mobile cash transfers, and Rwanda was not one of those countries. And yet, in this slide, what you see is that the transfers between individuals during the COVID lockdown in Rwanda had risen sixfold to 40 billion Rwandan dollars, which is $40 million. And we don't understand why. But our access to digital information, our access to digital data could also help us to understand these. Kenya, South Africa, we didn't see this. Why? I'm sorry, there's a bit of a delay when I change my slides. Yeah. So I'd like to encourage you by ending that we really do need African international postgraduate capacity building partnerships. They do matter because there's a very high rate of return, especially when you invest in higher education in Africa. And this is not just a high rate of return, but especially when you have gender and tertiary higher education. So COVID-19 provides research opportunities, same, but different. And just in conclusion, COVID-19 is an opportunity for Africa to look more forward. And I just want to leave you with this thought, which is from the Agenda 2063. It says, a prosperous Africa is based on inclusive growth and sustainable development. To achieve this ambition, one of the key goals for Africa is to ensure that its citizens are healthy and well-nourished, and adequate levels of investment are made to expand access to quality healthcare services for all.
Thank you, Professor Linley Chiwena Carlton, for your presentation. Very exciting. As we did with these presenters, we have also carefully selected from within Africa and from the diaspora 4 aspects who would respond to the presentations you just heard. Bear with me, participants. We would get to the open forum soon. I can see a lot of questions from the chat box, and some of you have also noted that you are yearning to speak. We would give you the opportunity to do so. But before then, just give us a few minutes. There are 4 of them, each given 5 minutes to respond to this presentation. First, Dr. Victor Owino, please get ready. So as I introduce you. So Dr. Victor Owino is a nutrition specialist in the Nutritional and Health-Related Environmental Studies section, Division of Health at the International Atomic Energy Agency in Vienna, Austria. IAEA's work in nutrition focuses on helping countries to assess various dimensions of nutrition using non-radioactive stable isotopes. Understanding breastfeeding patterns, micronutrient bioavailability, body composition, protein quality, and impact of environment on gut function in low and middle income countries via stable isotope techniques form the core of Dr. Owino's daily work. Dr. Owino, please go ahead and do your submission.
Good morning, everyone, and thank you, Amos, for the introduction. I'll start by saying that what I hear from the presenters is that COVID-19 found us in a very bad situation, but it is worsening what was already bad. And this is in the sense that, first, it has increased food insecurity, and it has also limited food choice. And a good example is this woman from Kenya, Mombasa City, who didn't have anything at all to cook for her children, so she resorted to cooking stones to make children feel that they are going to eat something. Number 2, I heard that the pandemic has actually disrupted the provision of life-saving interventions like immunization and micronutrient supplementation programs that are actually very, very fundamental to helping us achieve adequate nutritional status. But on the other hand, I also heard that it is not just food insecurity and the undernutrition. The pandemic is also affecting the other side of nutrition, and people are now being punished for doing physical exercise.
Oh, Theo Jen. Yeah.
a good example just came from Kenya the other day when in Kisumu, over 30 people were arrested for jogging. So the pandemic is eroding the intervention that we as nutritionists always preach about, good practices towards good nutrition and health. So the second thing I heard from the presenters is that not all is lost. There are opportunities to respond to the adverse impacts of the pandemic. And one of the things I've heard from the presenters is that we can actually learn from lessons from other pandemics like HIV, but there are actually existing interventions like school feeding programs that can be retrofitted to address the consequences of the pandemic. But I also heard that there could also be already existing tools that can be used. For example, Muzi mentioned food-based dietary guidelines that already exist. How can we integrate these existing tools to help us respond? But I also saw there was a comment from one of the participants that could COVID-19 actually be the disruptive moment that helps us to rethink what we do. And this ties in with what Lindley has been saying, that can we think about ways in which we can do things differently. For example, Lindley has said that traditionally people are eating more from restaurants than eating from home, but in lockdown, we've learned that you can actually cook fresh food every day. Is it time for us to rethink how we eat? Is it time to go back to cooking fresh foods? And also, is it possible that we can revisit our indigenous knowledge on the foods that have long been forgotten? For example, insects have been mentioned. But as we think about it, the question is, if we go back to some of these foods, how does that consumption affect nutrient utilization, absorption, and all that? So we must think outside the box, but also think of the consequences of what we are going to do. But lastly, and most importantly, I've heard from the presenters that it is very, very important to measure the consequences of COVID-19 in terms of clinical impact, but also in terms of behavior change and many other ways. But the question is, what are we going to measure and how are we going to measure it? And also, who is going to measure it? From the data that is available, we have very few people who are trained in nutrition and are able to do complex studies. So when you go through the list of studies that are published from our universities, they are very, very descriptive studies, people talking about factors affecting this and that. But my proposition is that the effect of COVID is going to be deeply clinical, and we are going to build capacity, to do more complex measurements. For example, if Lindley is talking about causality, causality is not just about socioeconomic factors. Causality is about the biochemical and all the other factors that link to nutrition and health. So my take is that we are going to leverage coalitions, as was mentioned by Muzi, and synergies to develop capacity to be able to utilize tools that are modern enough to enable us to do more detailed measurement of the indicators of the impact of COVID-19.
Okay.
And with this in mind, as I finish, one of the immediate impact of pandemics like this would be the changes in the biochemical composition of the human body. For example, change in fat, change in lean mass, and change in so many other things, protein composition. So do we have tools to measure those? And so this is one of the things I do on a daily basis, helping countries to measure body composition, helping countries to measure nutrient absorption. So we are going to utilize some of these tools going forward to be able to help us understand the impact of this pandemic. Thank you, Amos.
Thank you, Dr. Victor Owino. So next, the next discussant is Mrs. Julia Takweri. She is a nutritionist with over 40 years of work experience in nutrition programming, planning, policy development, and advocacy in the Caribbean and in Zimbabwe, her home country, and of course, other Saharan African countries. She has served on various food and nutrition related advisory panels and committees in Africa and internationally. Julia is a recipient of the 2012 Africa Nutrition Society's Award for her contribution to nutrition in Africa. And she's a member of Board of Trustees of the African Nutrition Society. Julia, I hope you are ready. Please go ahead and then do your submission.
Good afternoon, everybody. What a rich morning we've had. I think from the presentation so far, I'm left in no doubt of the impact of this pandemic on the socio-economic development of our continent, including health and nutrition, of course. But also one is heartened by the fact that there are some responses. We are responding. The lockdown is forcing us to actually look inward at what we can do. And that is heartening to know. And of course, the issue of the research agenda. And to be quite honest, maybe the lockdown will help us also create or generate our own research. We've tended to become consumers of other people's research. So the lockdown, for me, is providing an opportunity for us as a continent, perhaps to reset the button. Even if this ever ends, we understand we'll be having waves of these viruses, but supposing it ends, it can never be business as usual. Because I think what the lockdown has highlighted for us, for many of us, I think, we really didn't understand even our food systems, how food got into our markets. We now see the strengths and weaknesses, and these are things which hopefully moving forward, we need to try and redress, because without an effective food system, we can't be talking about nutrition. We've also realized that our health systems, the way they are currently configured, where we have over the years virtually abandoned primary health care. If I can remind us, some of us who are still, who were there when our MAATA was first established, it really focused on prevention and what the individual can do to protect themselves, to prevent getting sick. Yes, there was room for, if you can't, then you move to the next level where the health system can help you. But I think because now our health systems are so focused on trying to get these ventilators and getting ourselves COVID ready. And to be honest, I think to the detriment of the ongoing disease burden we continue to have. As you know, we still have a triple burden. Overnutrition, we also have micronutrient deficiencies and other nutrition. So I'm seeing an opportunity for us making a pact that it can't be business as usual. And I think from the earlier, I think it was Paul's presentation, we need to use this opportunity to strengthen, for example, the need for surveillance ongoing surveillance that tells us who is vulnerable, where are they, and what is the level of vulnerability. We can't, each time we have a pandemic of some sort or a shock, the first starting point is assessing who is affected and where are they, and how can we should have like a pot that is simmering, that at least has some indication of who are the vulnerable, where are they, what are the likely numbers, so that the response is not so delayed. But I want to bring us back to who really are the first responders. You know, that word has been coming, I've learned a new word over this pandemic, first responders. But to me, the first responder are the individuals, the communities. And somehow, I think because we have not really focused too much attention on how we can empower them with the kind of information that enables them to respond, even from where they are, with what they have. In our quest, we mean well. In our quest to help our communities, we do it unto them. And yet, as a couple of the presenters have mentioned, you know, there's a lot of indigenous knowledge which we are not taking on board. We have an incredible social capital as Africans, where if I don't have enough salt, I know I can knock on Francis's door and hopefully he will give me salt. These are of course, under COVID, you can imagine how under COVID, some of these systems are broken down. You can't be moving around. So whatever response we have has to take into account how if there can be such a thing as a typical African, how they respond, how they live, the kind of social capital they can draw on when there's a shock. And when that is locked up, how can our social protection be so structured that it builds on what we have? They are indigenous, as Isatu mentioned. Many countries, I discovered, it's not just unique to Zimbabwe. There were traditional ways the traditional leaders had a basic social safety net that took care of the elderly and the infirm and so on and so forth. And given that the isolation is the order of the day with COVID, maybe we need to reset the button on some of these systems that actually help people where they were. The movement of food from Accra or Harare or Joburg to wherever it's needed is also contraindicated under COVID. So how do we strengthen what is there, build on it, so that communities, you also limit movement? I'm just throwing this out because I'm just, it has been an eye-opener for me in terms of what we didn't know. And I think it goes back to the need for this research agenda. I'm sure the food systems vary in countries, but when we look at the social safety net we need to put in place, we have to think in terms of having an ecosystem. Because when you give, say, the vendor has the loader, the transporter, and the farmer. You know, it's part of a chain. So if you give whatever, 2 CDs to the vendor, there are these other people who are part of the ecosystem for getting food to the market. And how do we make sure that we capture all those? Because we have a lot of people who are going to need assistance. But I'm seeing also the opportunity provided for the nutrition sector in re-emphasizing again the relevance. We need to be relevant to this pandemic. We need to restate that nutrition is relevant to socioeconomic development. It's also an opportunity to state that. And we know that the immune system already is compromised through poor nutrition. Now you have something that is also attacking the immune system. It did the same with HIV. And nutrition has a role to play in developing the immune system. So we
exactly. Julia, if you can wrap up.
Yes, no, I will.
Yes, go ahead.
Sorry, you know, once I get going, I have a problem to stop. But I'm saying that we also, in all our discussion, let's see how we can empower our communities, because they are the first responders with the kind of information, whether it's on nutrition or whatever, so that they can begin to help themselves. Right now, they are waiting on somebody to respond, and we have, in a way, disempowered through our efforts, well meant, to do it for them, and yet they have some incredible coping mechanisms. Those that are harmful, we need to discourage, but there's some good ones which we can learn from and build on. I will there.
Thank you very much, Julia. Thank you. So our next discussant is Mudu Fall. He's a Gambian and a public health nutritionist. He is the current executive director of the National Nutrition Agency under the office of their vice president. Mr. Fall has wide experience in food and nutrition policy and strategy development, and in health and nutrition project management. He is the current focal point for the ECOWAS Nutrition Forum, Sun Movement focal point also in his country. And he's the interim president of the Nutrition Society of the Gambia. Mr. Fall is also a council member of FANUS. Mr. Fall, if you're ready, please go ahead. Your 5 minutes starts now.
5 minutes, okay, thank you. Thank you. I mean, I think like other speakers before me, I definitely need to confess that this is a very rich discussion, and speakers that have been chosen, I think we didn't make mistake in getting them on board. But first of all, I would just like to put into context. I know this COVID-19 has made most countries unaware. It catches unaware. I mean, none of us were really ready for a pandemic of this magnitude. So therefore, it means that, we have to start scrambling here and there. Looking at the major impacts, it's on the health and nutrition, economic and social dimension. And I think, as other people are saying, it may take us back a little bit, for us to recover, not only in Africa, but Europe and America to recover from this pandemic. But putting things into context as far as the presentations are concerned, I think the first presenters did a very good job talking about the food systems and how they should really try to make sure that, well after the COVID-19 or during the COVID-19, we look at our food systems. But since the two speakers are very near to FAO and NEPAD, I think what we should be looking at is the future. How are we going to ensure that in the future, our food systems are well developed and established? And I think this is where FAO need to do some work with the African governments or the governments that are under them to make sure that, the farmers, we didn't forget the farmers as far as the response is concerned. This is the right time, especially in West Africa, where the rainy seasons are fast approaching. I think issues relating to seeds, issues relating to fertilizer, and all those things should be readily available by the governments and the UN bodies that are responsible. I like the idea of the short value chain, and I think in situations where we are having food insecurity, we should try to look at what is readily available and how quickly we can get those food crops, be available to the farmers and the families. We all know, even under normal circumstances, Africa do suffer from food insecurity, especially during the hungry season, that is in August and September. So I think that is one area we really need to look at. The other area that he did mention was area of joint efforts. And this is where I think not only the African governments, but the UN partners and even the donor government, the donor partners should come together to ensure that, there is collaboration, there is synergy in the approach to supporting the people who are actually having the problem. Then looking at Professor Paul Amona's presentation, I think this is where I was really touched when he started talking about maternal, postnatal child immunization, vitamin A supplementation, iron and growth monitoring. all put to halt or near halt. Then that means how are we going to prevent some of the major infections? And we already know when nutritional status begin to go down, your immune system also goes down. And when the immune system goes down, infections can be easily cut. So this is an area where we really need to revisit to make sure that, I don't know what methods we're going to use to make sure that children get access to their vitamin A supplementation and their immunization. And scarcely talking about low birth weight again, I think this is something that we really need to make some effort to work with WHO and UNICEF to see how best clinics can be opened. In the Gambia here, we train some women who were able to take MUAC of their children. So we're still working with those women on a monthly basis to be looking at the MUAC of their children so that they don't watch silently as the children get into malnutrition. Then getting into the area of social protection, which I am currently being involved and which Aisha to delve into. I think this is one of the main interventions that is being done worldwide. If you look at the WHO social protection news, you will see that in Latin America, in Africa, even in the Mediterranean, there is a lot of social protection taking place. But again, the issue is about how do we go about the targeting? Because when you don't have a universal coverage, you have to get into targeting, and targeting seems to be a very daisy area, and it may take a lot of time. But here in the Gambia, we are trying to circumvent it, because so far we have started doing some cash transfers, we have started doing in-kind transfers, and so and things are working very well. And then there is one area that she also touched on is about the issue of breastfeeding. How do we maintain breastfeeding? And how do we also make sure that the international donors don't mess up with the breastfeeding that we are having? What I mean by trying to put as part of their food aid, breast milk substitutes. And I think there is an article, a joint statement by WHO and UNICEF, putting us on the alert to make sure that, we are watchful about these multinationals to make sure that as part of their campaign, they don't try to undermine breastfeeding issues in this part of the world. Because when you say that, COVID-19, the virus is transferred through fluids or liquids and other things, and then breastfeeding is a fluid, then there might be a mismessaging to say that, hey, is it not possible to get your COVID-19 from breastfeeding? And I think this is one area where we really need to make more efforts.
Okay. Mudu, so if you can wrap up, Mudu.
Yeah, I'm wrapping up. Throughout the discussion, one thing did not come about, which is about the social and behavior change communication, the nutrition education bit. I think definitely this is one area. Since social distancing is becoming a problem, if we can make use of the radios, the televisions, to make sure that we communicate to the population to pass on the messages that we really want to pass on. Somebody talked about the indigenous food security. Here in the Gambia, we have what we call child food banks that we are encouraging communities to get into, though we haven't got all over the country, but there are certain almost 400 villages that are having child food banks that can be used in case of emergencies. So thank you. Though I have some other comments, but I'm limited by time.
Yes, thank you. And I think during the open forum, there will be an opportunity to interact with the participants as well. Okay, so some of those can be delivered through there. Thank you. Last but not least, the fourth discussant is Dr. Habiba Hassan Wasef, a former senior WHO staff member. He is currently an international expert in health and nutrition policy in sustainable development. She's actively contributed in the capacity of an expert stakeholder to formulation of the roadmap for the European and African strategic partnership in research and innovation in food and nutrition security and sustainable agriculture. Her expert services continue to be sought by bilateral, regional, and multilateral organizations in Europe, the Middle East, and Africa. A member of the African Food Safety Network, she is a trustee of the African Nutrition Society and vice president of the Africa Mycotoxicology Society. Sorry. She is a laureate of several international and European as well as African awards and prizes. Dr. Habiba Hassan Wasef. Please go ahead and do your presentation.
Thank you. Thank you. Can I start?
Yes, please go ahead.
Yeah. I think that all the past presentations were so rich and so full, and the discussants picked up so many points, but I am going to just mention a few points that are near to my heart because I've been running after them for many years, and yet COVID-19 gives Africa the opportunity to look into them. I mean, it takes a pandemic for us, for Africans to look inwards, as Lindley said. We have in our resolutions, whether it's and policy frameworks, whether it's Africa Agenda 2063 or the declaration of the Third Africa Science and Technology Forum, where we said Africa has to benefit from its rich biodiversity and depend on its food heritage and natural food resources as the first pillar in the fight for improving food and nutrition security. And no action had been taken, and there comes COVID-19. And I think that what Lindley has said is a roadmap for researchers and scientists to follow. It's a very, very comprehensive, complete presentation towards that end. Self-sufficiency and self-dependence. And she goes by it scientifically. She goes through the research and science and information and study and observation. And it is a really fantastic roadmap that I recommend all scientists to seriously look into it. Now, I'll pick up a few comments on the FAO comment. We talk about food systems and food that has to do with food production. I'm a health nutritionist. So does increased production of food make the family eat better? In the COVID context, we tend to depend on social protection and safety nets in order for the family to have food on the table. But then it was mentioned that what is the state of the civil status documentation in African countries? Do all African countries know where the poor are so that they can better target the assistance or the social protection? In my country, I can speak for my country, we have made an extremely serious effort. There is an ID for every Egyptian. But when we did with the African Union Commission, the biennial review of the Malabo Declaration, we found that not all African countries could account or know where the poor are. So this was mentioned more than once in more than one presentation, and it's very important for the food assistance in times of crisis to reach the correct person. Now, in FAO stressed the dietary guidelines. They were also mentioned in other presentations. And then we go back to what Lindley said. How much of local food and indigenous food are in the dietary guidelines? Not many. The one country that has made a very good effort and the dietary guidelines account for all food eaten in the country is South Africa. the food and nutrition security. A question mark is also addressed to FAO, who I would like that they make sure that every country has some sort of coordinating body responsible for food and nutrition security. Does this exist in every country? In my country, we don't have it.
Okay.
So let me go to the presentation of Bibi on the Auda NetPad. The Continental COVID Task Force meeting was Ministers of Agriculture. I would like to more attention to the link between the health ministers and the agriculture. I think there should be a combined meeting, or I don't know, maybe you do combine the health authorities and the health responsible people in the task force, so that an agricultural strategy can bear and improve the health condition of people, and the health intervention can improve the agricultural strategy, especially on guidance of what to put in the food aid and the food baskets and the food boxes that are distributed. Who looks into what is done, what is in them?
Okay, so if you can wrap up on that point, Habiba.
Yeah, I just have a few points on the three other. On Paul, I'd like to draw, it was a complete presentation, and I would like to stress the importance of breastfeeding that he mentioned is 40% as exclusive breastfeeding is followed by 40% only in Africa. And the immune system, which is our first defense against the COVID-19, is through a well-developed immune system, and it does only develop thanks to the colostrum, the early milk, and the breast milk of mothers. So this is terribly important. In the social protection, it is terribly important to learn from past indigenous knowledge and practice. There is another mention of the looking inside and not looking outwards. For Linley, I did say that the research, the presentation gives a full research agenda, and I do hope that African researchers follow a lot of what is in it as a guidance for the programs. Thank you.
Okay. Thank you very much, Habiba. And also thank you to all the participants who have been patiently waiting for their turn to contribute. We do acknowledge and value you. Your patience is highly appreciated. So at this time, I would like to pick a few questions from the chat box, 5 of them. Some of them are directly linked to the presenters, others are floating, and any of the presenters can comment, or discussants can comment on them. Once we do that, we'll take direct questions from participants. If you need to ask a question, just raise your hand, and then we would identify you, unmute you, and then you can speak. But before then, we are going to address these 5 questions. So the first question is from Dr. Rahman Joda. He said, what efforts should be there to secure nutrition as well as food, especially for women and children in these challenging times? I think at the chat box, Bibi attempted addressing this. If you wish to respond to this, either Bibi or Aisatu, that should be fine. So efforts that are there to scale nutrition as well as food, especially for women and children during this challenging time. That's the first question. The second question is from Dr. Namokolo Kovic. Actually a contribution, but speakers may respond to it. She said, I worry about celebrating too early on Africa's COVID-19 cases. We should look at the trajectory of increase at the moment, and it is worrying. Whilst many countries acted early to mitigate, the release of restriction is happening at a time when the rates of infection are just picking up in many countries. And Dr. Elizabeth Kimani Murray from African Population and Health Research Center agrees with Dr. Kovic. So that's the second question. The third question from Dr. Emmanuel Alamu is directed to Professor Amuna. He says, my question to Paul is, could the low reported cases be due to low infection or lack of testing in Africa? So he's referring to the number of cases of COVID-19 in Africa. The fourth question is, okay, so there's no name here. Halilu indicated that I'm very much concerned about the testing kits used in Africa. Also, the support system for food supplies is not uniform. And then I moved to the fifth question, and then the speakers and discussants can address them. This is from Ruby Atta. He said, hello, what are we doing in Ghana to ensure health issues such as high rise in neonatal jaundice is not increased in other regions or in other regional areas? So 5 questions from the chat box to the speakers. Some of the questions are directly linked to the speakers. Those that are floating, any of the speakers, please feel free to address them. So may we start with the one that has named the speaker? So maybe Paul, if you could respond to the question that specifically mentions you, and then the others can address the other questions. Okay. Hello, Paul. Otherwise, any of the speakers, please go ahead.
Okay, thank you very much, Musa. This is Bibi. I think I said you can add. I did attempt to answer the question on efforts to provide food and nutrition for women and children. I think what has become very clear, making a reference to Julia's point, that we need a stronger nutrition surveillance system, because unless and until we know who is affected, where they are, and what kind of support they need, it makes planning extremely difficult and targeting even more so. So what has happened is that just based on the nominal information available in different countries, there has been an attempt to provide the food parcels. However, I must emphasize, unfortunately, the food parcels have not been providing much of the much needed vitamins and minerals. Case in point, in South Africa, what I've seen being provided was largely starch, oil, sugar, and a little bit of canned goods. So that is not enough. So we need to step in and provide the kind of guidance that will allow for the social safety net to know what to provide. Let me ask Isatu to add on something. Thank you.
Okay, thank you. Isatu.
Thank you, Bibi. I don't think there's much I can add, except to say that I believe in building on something that already exists. In every single country, Gambia is an example, Modufal just spoke about it. They have programs targeting women and children. You don't have to start a new program. Build on what already exists and work with the communities. Because the communities, when it comes to targeting, nobody can do it better than the communities. If you sit at the central level and you want to do targeting, that would be a great mistake. Work with the communities. And as far as mothers and children are concerned, I already talked about, breastfeeding mothers. Because when we talk about social protection and we target the adults and the adults only, we need to work along the life cycle. So work with the communities, build on existing programs, because every single country has an existing program targeting mothers and children. Thank you very much.
Thank you. So Paul just rejoined. So there was a question directed to Paul, and Dr. Emmanuel Alamu wanted to know if you could comment on whether or not the seemingly low cases that we are seeing in Africa of COVID-19 are actually due to low penetrance of our test? Is it that the coverage is low and that's why the numbers are low, or they are actually low? A question from Dr. Emmanuel Alamu.
Okay, thank you very much. I think this is a very important question, and it relates to a point that was made earlier also by Dr. Namukolo and then others. And if you go to the chat box, you find that whilst the discussions were going on, various speakers were responding to some of these questions. So there are there's a lot of discussion and debate going on, which is very, very healthy. But just to come back to the specific point, it is true that, you know, Africa CDC is one of the organizations that helped to make testing kits and things available in Africa. We have to give them a lot of credit for the efforts that they made to help African countries be able to test. However, having said that, testing has not been uniform across the board. In some countries, testing has been very good. In other countries, there have been arguments that not enough testing is being done. In fact, there is some argument that the Africa counts are low because of lack of testing. And then, of course, there's a question of the reliability of the tests that are being carried out and things like that. Now, all that said, even if we added the fact that there is under-testing and also about the sensitivity and the specificity of the tests that are being carried out, our numbers on the continent are still relatively low compared to all the other continents. And so in a way, yes, it is true that I believe we are undercounting. And secondly, I believe that there are therefore a number of deaths that we have not taken account of, which are COVID related. Now remember, when we're talking about deaths and COVID related deaths, there are two. There are those that are directly related to COVID in terms of people getting the disease and then dying from it or complications. And as Dr. Polai mentioned in his comments in the chat, there are, for example, cases of children with malaria dying as a result of COVID, for example. But there is also the so-called excess deaths. Excess deaths. In other words, deaths that are occurring that normally would not have occurred, but for the fact that we now have COVID, and either because it is affecting health services, utilization of other services, the mobilization of resources and redirection more into COVID cases, and so on and so forth. And for example, in Ghana, there was an outbreak of meningitis, and that was affecting more than 35 deaths. And at the same time, the whole country has only had about 35 deaths from COVID. So the question is, where do you pull your resources? I want to say this, that in some African countries where testing has not been taken seriously, the way out for us is more testing, more tracing, ensuring that we are sure that the levels in our countries are actually low, because there is a real risk, as we have seen elsewhere in other parts of the world, that there can be a second wave of this infection. So the fact that our numbers are low doesn't mean that we are free. So let's be very, very careful. There could be a second wave. So those who are not testing, we need to encourage them to do more testing. And then, of course, to follow the public health measures to make sure that we don't spread the disease. Thank you.
Thank you, Paul. So at this stage, I'm going to allow questions from the audience who have raised their hands. So Lizzie, I'm unmuting you. If you can briefly ask your question, you may direct it to any of the speakers or float it for any of them to respond to. So Lizzie Egbin, please go ahead. Briefly.
Thank you very much, and good morning, good afternoon, everybody. I'm Lizzie Ibine. I'm speaking from Nigeria. From the discussions that is ongoing this morning, I discovered that there's a common thing that we can do to help and reduce the stunting and the wasting rates in malnutrition. And that is to get back to our communities and teach the women and the local people how to do home garden, where they will have access to fresh vegetables at all times, at least to cook each meal per day with vegetables.
Okay, home gardening. Thank you.
Yes, if we can teach them and teach them even to use pots, like wasted plastics.
Okay. Okay. So the next person with a hand up is Iris Rochaya. So Iris, you've been unmuted. So please go ahead and ask your question. Is your question still relevant? Okay, so I go to tell Tikalin G. Please go ahead.
Thank you very much, organizers. I'm Takalin from University of Bonn, live in Germany, originally from Ethiopia. My question goes to Paul or Linley or any other could add to that. My question is Africa heading toward this food crisis? We know COVID is affecting the food security situation. But do you think is Africa heading toward this food crisis? If not,
okay.
Thank you.
Okay, thank you. So Iris Rochaya, please go ahead. Okay. Paul Opio, please. Your hand is up. So Paul is unmuted. If your question is still relevant, please go ahead and ask.
Yes, what I wish to add to the discussion is that what is going to be very integral for Africa is that there is need for governments to ramp up the social protection. In that, we are not just looking at the distribution of food, but we need to look at more integral aspects, not just nutrition alone, but how are we helping even the communities to be able to improve their livelihoods. But still, in these social protectionist measures, another thing that is important going post-COVID is that even as we would like to help, would like to recover, say, the economic, if we are having protectionist measures of, say, giving money to putting money in people's pockets. How do we balance this with inflation? Because inflation can have a serious impact on the economic recovery. So we need to balance the two. But then also, many food and nutrition security studies focus on rural areas. How do we bring this up even to the urban and peri-urban, whereby we have a large number of informal people who are most likely to be affected by this?
Okay, thank you. And then the last question, and I would go back to the discussants and then presenters to respond to, is from Edgar. Edgar, you are unmuted, so please go ahead and ask your question or make your
Thank you very much, and it was really wonderful to be part of this conversation. But for me, I have two questions. One is, how do we find ourselves on the table where decisions are being made? And then secondly, how then do we scale up some of these wonderful interventions? Because it is through working at scale that you'll actually have some tangible effects, especially during this COVID-19, because we find that we have nutrition interventions, but they're at very low scale that cannot have any effect. So how then do we make sure that nutrition interventions are actually working at scale to have some very good impact in Africa? Thank you.
Okay, thank you. And so I will get back to the presenters and discussants. Any of you ready to respond to any of the questions, please go ahead. And then after this round, I would go back to the chat box and then fill 5 questions from those who have submitted their questions or contributions through the chat box. Thank you. So over to the presenters and discussants.
Okay, Paul here. If I can just come in.
Yes, please
I
go ahead.
agree that we need to find ways of reducing stunting and underweight. I think the idea of home gardening is a very good one, and it's one that we need to look at. There are examples of how this has been trialed in Africa and elsewhere, and how it is working. The idea of using pots and pans and anything that is a waste kind of receptacle to grow vegetables is a good thing. A lot of our soils are actually rich, and we should be able to take advantage of any space to grow vegetables that can be used in the home. And there is a question about whether Africa is heading towards a food crisis. Now, here we are, that before COVID struck, there was already a big problem about the locust and armyworm invasion along the Eastern Corridor, along the Eastern Africa region. Now, what happens with these locust invasions is that, for me, they are a sign that there is going to be drought and that there is likely to be food shortages. And so in that region already, there was awareness and there were a lot of actions being taken in order to stem the tide because of the locust invasion. And then COVID has come to add to that. So I can say that for countries in the along the Eastern Corridor, from Kenya all the way through Ethiopia, Eritrea, Djibouti, Somalia, there may be a risk of a food crisis that is compounded by COVID. And I'm sure that the authorities are doing everything. At the AU level, this was raised by the AU Agriculture and Food Ministers. When they met on the 16th of April, they came out with some kind of recommendations and commitments, one of which was to look at this issue. So that is a general issue. There is also the other issue, which I think sometimes we tend to confuse with a crisis like this. You see, around this time in many parts of Africa, for example, in West Africa, is a farming season. Around the farming season, food prices tend to go up anyway. And the reason is that usually at that time, there isn't a lot of fresh produce and people are using the grains to start farming and so on. So we just hope that that particular hike that we have seen that has been compounded by COVID will come down. And we also hope that the rains will be kind to us, because truth be told, we are still very dependent on the natural forces of rainfall for our agriculture in Africa. And irrigation and all these other things are issues that we need to address. The FAO has come up with some brilliant papers on this. The Africa Development Bank has come up with a strategy paper, fantastic, about how we should support our farmers and farming and agriculture and so on and so forth. I think one of our challenges, and it comes to Paul Opio's question, is that at national level, even though we have strategies, and I think Aissatou mentioned some of these in terms of social protection, policies and strategies, the problem is implementation. Implementation is always our challenge, whether it is nutrition or whatever. And so at national level, we need to actually have effective national planning commissions, effective groups. The SAN movements in country need to be a pressure group. They need to be working together to help implementation. In our academic institutions, we should be teaching our students and translating whatever are in our documents into our curricula, so that when these students graduate, they go out there empowered, knowing how to do things. We're talking about how we can empower communities. We need to start empowering ourselves and so on at every level. So I think these are very important things to look at. And to scale up at national level, I believe that the SAN movements are very important. I believe that nutrition and food should be at the center of the national dialogue regarding COVID and beyond COVID. At the moment, a lot of the dialogue does not include nutrition, and even the national interministerial committees and all those things, I don't see nutrition being at the heart of the debate. So we need to push and make sure that these things come to the fore. Thank you.
Okay, thank you, thank you. Whilst the other speakers are ready to respond to the questions, Abel, I'm unable to unmute some of the speakers. So if you can help me, Mudu Fal is ready to contribute. I'm unable to unmute him. So if you can do that for me. Yes, so the other speakers, once you are ready, go ahead and respond to the question.
I can unmute myself. Is that okay? This is Linley.
Yes, go ahead. Yes, Linley, go ahead.
Thank you very much. And thank you so much for these wonderful questions. I'm looking at the chat and there's a lot of important issues that the audience is raising. I just want to add a few things to what Paul has said without repeating. And one of the questions was, is Africa, heading towards a food crisis? And I think one of the speakers mentioned the role and importance of the social capital that Africa has. We have to remember that Africans have been very resourceful. African food systems are very resilient if we choose to make them resilient. Here goes in the policy issues, but they're also adaptive. And let's not forget our cultural, socio-cultural capital that we have, particularly if we're thinking about the kinships and the networks that have sustained food shortages, even though we're very much dependent on rain-fed agriculture. But these kinships and networks are key. And the issue, the whole aspect of Ubuntu, which we should keep going back and revisiting. What does Ubuntu really mean? And then the next question, which one of the, I can't remember the name, participants asked was, how do we find ourselves where the decisions are being made? And I just want to share something that I found very thought-provoking, and which is by Shirley Chisholm, who was actually the first African-American individual to run for presidency in the United States. And this is her exact quote. And she says, "If there is no chair at the table for you, bring your own chair." And too often, I think we use the excuse that I haven't been invited, I'm not asked to be there, I don't know how to get into these rooms. But I think sometimes the onus is on us as individuals to make our own ways and to get into those discussions, such as the one we're having today. You hear about having a digital conversation with ANS. Get yourself enough bundles. I know it's an investment, but believe you me, it's an investment that you will appreciate in the long term.
Okay. So any other comment? And then I will try and bring in the last batch of questions. We are running behind time, 10 minutes behind time at this moment. So I would bring in if you agree with me, bring in the large batch of questions from the chat box. And yes, is it Mudu?
Just a quick one, just a quick one.
Yes, go ahead, Mudu. Yes, go ahead.
Okay. I like the ideas of the home gardens, and I think this should be encouraged. But it's not only enough to have a home garden, it should go along with some nutrition education as to what these people should be adding to the gardens, because most often than not, it's just vegetables that they are growing. I just want to give you an example of what we are doing here in the Gambia, because somebody asked, it's not only giving out sugar, rice, or oil, but we also have a program here where we intend to give people some cars so that they will do the nutrition bit in addition to the rice and the oil, so that they can go to the market, buy their fish, buy their vegetables and their fruits. So this is, but again, the other question, is Africa headed for food crisis? I think the situation looks very bleak. But one thing that I also want to bring along into the discussion is the issue of civil service, because Professor Amuna was saying that we should be charging government, but as civil servants, sometimes we cannot do that. This is where the scaling of nutrition, some movement, especially the civil society aspect, is becoming very important, so that they can take government to tax. So, as to their responsibility to the citizens. Thank you.
Okay. Thank you.
Amos,
Victor. Yes, Victor. Go ahead.
Yes, thank you very much. I just in partial response to Edgar's question on how do we scale up interventions. And 2 points. One is nothing will happen without champions. So we need champions who can actually demonstrate in the street to say that nutrition is important. Number two, without data, we cannot convince anyone that anything works. So we really need to strengthen our data systems to be able to document. And related to that, how do we communicate what we've found and the data we have to policymakers so that they buy into what we are saying? When I go around the countries I support, I find that people who work in the Ministry of Health have no idea what nutritionists are doing on the ground. So if they don't know, how can they do anything about it? Thank you very much.
Thank you, thank you. And with your permission, I'm taking the last batch of questions because we still have one more session to do. So talking about data, I think this question relates to data. How do we monitor mobile cash transfers, especially in rural areas where we have vulnerable communities? So some of the social protection initiatives and interventions that were presented by Esatu and then Bibi. So there's a question here: how do we monitor how cash transfers are done and their impact in rural and vulnerable communities? There's a question from Dr. Paul. So that question from Molasi. There's a question from Dr. Paul Aye, who says, it looks like no one is talking about malaria-induced deaths in children in these COVID times. Can anyone tell me what is really happening? So that's the second question. The third question from Saibu Isifu. He noted that observing how the entire COVID-19 has been medicalized across the continents, how can we reinforce and make nutrition visible and the pivot for which COVID-19 fight revolves? So that's the third question, fourth question. And the last question from Richmond. So his question is to, I think, all the speakers. What are the best strategies for delivering social goods, food, cash, healthcare to vulnerable in the context of COVID-19? In some settings, politicians provide hot meals once a day using risky means. For example, not adhering to social distancing protocols. So these are our last batch of questions. Please, if we can address them, and then we move to the next and very final session. So anyone ready can unmute himself or herself and address these questions. If you need me to repeat any of them, let me know.
Thank you very much. This is Bibi. I'll attempt
go ahead.
to raise a couple of points. Thank you. On the question, just to add on to what Lindley said, that if you don't have a chair at the table, please bring one. The second I would like to make on that point of, how do we get to the table is that we really need to start drumming up or re-drumming up our advocacy and honing our messages so that the messages are very clear. They are very non-technobabble. They are structured and they can reach as many people as possible. For example, a very important constituency for us, as AU, NAPAD, FAO, we are working with parliamentarians, and we found that they actually had very little knowledge of nutrition. But since we engaged, they have been our best champions to deliver the message and to make change that is required on the ground. And then on the nutrition guidelines or guidance, to date, I have not seen any dedicated nutrition guidelines as such. However, suffice to say, we have started working on those from a general perspective and then drilling down to a sector-specific nutrition guidance. And then on the COVID medicalizing, being so medicalized, I couldn't agree more with the frustration. For me, it also reminds me of back when nutrition was viewed from a very narrow lens, but now this is yet another opportunity for us to start opening up that space to say, what is the role of food systems? What is the role of social protection, education, financing, etc., etc. And if we truly can band together with the understanding of what accountability we have in different sectors, I think that would be a way to address some of these gaps and challenges. Over.
Okay, thank you very much. Any from the discussants, the presenters, you can address any of the questions, and then we move to the final section, the closing remarks and way forward.
Okay, very quickly, Paul here.
Okay,
I
Paul,
think the question
Paul,
that
and
was,
then okay.
yes,
Yeah, Paul,
the
go ahead,
question
and
that
then
was,
you can.
Thank you. The question that was asked by Paulai, for example, is just an example of how COVID is affecting other aspects of health services. And so it's an issue that at national level, we need to balance, because somehow it seems to me that so much resources have been devoted to fighting COVID, which is quite important and which is quite good. But somehow to the neglect of some of the other services. And also there is the fact that now people are even refusing to attend clinics because of the fear of COVID. So there is a combination of factors. Public education, awareness, understanding is very important. A classic example of a country that has got it right is Mauritius. Please let us go and read about what they've done in Mauritius, where there is a direct link between the government and the community. They made everybody aware of what was happening. They got the media, the private sector all working together, and they were able to institute social protection. The question has been asked about how we distribute food and other things without the chaos and without all the difficulties that have arisen. First of all, you must have good records. You must have good records. And I would advocate a register in every district, in every region of the country, so that we know who the vulnerable groups are even before we start. Let's start from the schools, because from the schools, we know which children are poor, who are those who are on school feeding programs, and so on and so forth. So when we start like that and we start gathering good and accurate data, then when it comes to distributing these things, instead of the chaos where you come and start throwing food into the air for people to dive and people start fighting and then you spread the disease, we'll have an ordered way of doing it. I saw an example in Togo where they actually put various food, materials in they put them in certain order, where the people would then go, they'll call your name and you go and you pick your consignment and you take it home. Now, there are a lot of examples that we can learn from. And I think that it is important that we actually get these things right. Because you see, at the end of the day, COVID has taught us that whatever we do, whether we're talking about health, we're talking about economics, whatever we do, at the end of the day, the bottom line of what prevents people from going out and protesting is food and nutrition. And so we need to find our way to the table. We need, as someone said, to have champions, and we need to be at the center of the debate in terms of nutrition for the good of the country, and also in terms of nutrition for development and school feeding. I think we haven't talked a lot about school-based feeding, but there have been questions asked about this in the chat room. And I want to say that we need to seriously look at how we can get groups at national level to sit down and start planning on how we are going to reinstitute school feeding when the schools are reopened. This is important. Thank you.
Okay, thank you. And a very, last comment from the speakers or discussants, and then we move to the next session. Please go ahead. Isatu, please go ahead.
Yes. Okay, I agree with everyone saying we have to find our way to the table. But we are in a situation now where we have our own table and people should come to us. Think about COVID-19. What are people saying? To be killed by COVID-19, to die from COVID-19, or to die from hunger? And hunger is food and nutrition. So let's not be modest, at least for the African continent. Let us take our table out there and let people come to us. We have the power now and we're in that particular situation. So let's make use of it. This is one opportunity that we may never get again, because I don't ever want to see a pandemic again in my lifetime. Once is enough. Thank you.
Thank you, Esther. And so at this stage, please just bear with me. Let me bring in the final speaker, Professor Francis Zotto. Professor Zotto is a professor of public health nutrition at the School of Public Health, University of Health and Allied Sciences in Ho, Ghana. He is a recognized leader spanning over 2 decades in nutrition across Africa, and has been instrumental in driving and promoting the establishment of a strong nutrition profession on the continent. Training and research to underpin program delivery across health and education sectors in Africa. He serves as a trustee of the African Nutrition Society and also a trustee of the Federation of African Nutrition Societies, FANUS. Currently, he serves on the Council of the International Union of Nutritional Sciences, IUNS, a body that oversees the strategic directions of nutrition globally. Professor Francis Zotto, I hope you are ready, and please go ahead with your closing remarks and then way forward.
Francis needs to be unmuted, please.
Okay, so Abel, if you can help me, whilst I also search to get Francis. Francis, you should be able to unmute yourself. Okay.
No, I tried several times.
Oh, okay.
This has been a wonderful, wonderful webinar. And I cannot go over what our presenters and our discussants have talked about. Now, in a nutshell, what I observed is that I'm going to give a clarion. Hello, can you hear me? Hello?
Yes, we can. I can hear you. I can hear you, yes. Mm.
This is a clarion call for us all, and I need all hands on deck. Now, I start to make mention of something very important. We now have the power. And if we have the power, then we as Africans must catalyze nutrition actions and make a difference. The presentations as we've heard so far and the discussions have really brought into focus the need to tap into our local resources to address our nutritional challenges as a continent. My good friends, nobody can do this for us. They also show that it is no more business as usual, and that nutrition-related policies and strategies will need to be reviewed in a manner that accommodates the public health measures imposed in containing the COVID-19 pandemic. My good friends, you and I know that with the human population in sub-Saharan Africa expected to double and food demand triple over the next 50 years, the decisions that we make today, you and I make today, can have profound effects on the future. How do we address the challenge of achieving zero hunger in sub-Saharan Africa, whilst also reducing the inequalities and conserving the ecosystems that has perhaps never been more critical and needs a cross-sectional working among ourselves to be effective? You and I know that our continent, Africa, has over 60% of the world's arable land. And yet, it is also a question where malnutrition is a challenge. We have social and economic problems, as has been outlined. And this has held back our development as a continent. I know that the continent has signed up to several initiatives. As earlier mentioned, the current landscape, as I see it in this webinar, gives me hope that Africa is rising and there are continental moves to bring about a change. Now, if I may share my screen, I don't know if this has come up. I'm going to talk through this. A lot of people don't know about Africa, but a take-home message for me is that we need to harness the resources that we have. What are those resources? We're talking about oil, we're talking about the land that we have, we're talking about the minerals. How do we break down barriers that are associated with our long-standing separation? How do we seek to accelerate and implement the existing continental initiatives for equitable growth and development? How do we support the creation of an enabling political environment with strong in-country leadership? It is important that we establish best practice for scaling up proven post-COVID-19 nutrition-specific and nutrition-sensitive interventions and adopt the positive deviance approach across countries. For example, Ghana can learn from Gambia. Nigeria can learn from Kenya. What are the things that are happening in these countries that we can learn on? And that is what I refer to as the positive deviance approach. How do we strengthen capacity for food and nutrition security at all levels? Integrate and strengthen appropriate nutrition-specific and nutrition-related strategies in the country's disaster preparedness plan. My good friends, and I say it without missing words, that you and I are carrying in our hands the baton. What are we passing to the next generation? We must begin to work together and learn from each other with a continental mentality, particularly in this time of COVID-19 pandemic. And this has come to also reveal to us that our salvation lies in our collective efforts, pooling our resources and directing them towards a coherent, aligned approach to maximize both our human and natural resources. This is the only way that Africa can become self-dependent. We've talked about the 2013 Africa Development Agenda. Yes, our leaders are moving towards an Afro currency. They're moving towards an intra-Africa travel and trade space. We must now move forward and adopt the golden triangle approach. We need to develop partnerships among in-country government institutions, the private sector, and civil society. My good friends, as I look at you in the face, you and I can work collectively. We cannot sit down and expect anybody to do this for us. You may say, I'm just a little fish, but come on board. The African Nutrition Society is ready to partner with you. The FAO is ready to partner with you. FANUS is ready to partner with you. Can we work together? Take the baton that we have in our hands and say, I want to hand this baton over to the next generation. I want to make a difference. You and I have what it takes to make that difference. And until we begin to rise up and make that difference, we aren't going nowhere. We need to be proactive and all hands on deck. Africa must rise up from the doldrum. And I believe that the COVID-19 has come to awaken the giant that is within us. The sleeping lion has woken. And if the sleeping lion has woken, let us go into the villages, into the rural areas, and as somebody said, how can we begin to teach our local women, our local men, the skills that they have, the skills that we have, standing by side with them and working collectively to address our nutritional problems. I cannot say it enough. You and I have what it takes to solve our problems. So this webinar has been put forward for you. I need you to come on board with me. I need you to come on board with the presenters. I need you to come on board with the discussant and let us make a difference. Thank you very much, Amos.
Thank you, Professor. Thank you very much. At this time, let me just take less than a minute to say thank you to our very excellent presenters and discussants. And of course, the participants who have been full of energy. We started this at 9, it's already 12, 3 hours, and yet they are still active. There are so many questions coming and via the chat box. Unfortunately, we can't take questions at this stage, but we will pledge to make use of your input, to make use of your questions into the report, the document that we are going to develop following this webinar. And so all of your input would be acknowledged in that report. And so at this moment, just allow me to once again say a big thank you to our partners, FAO, IUNS, ANH, AU, and all those who have supported to making this a reality. So we thank you very much. We'll be in touch. We have your contact, and we look forward to engaging you in our subsequent webinars. So thank you very much.
Thank you, Amos, and thank you to the presenters, and thank you to the discussants, and most importantly, thank you to the participants. We really enjoyed this, and I believe this is one of the steps going forward. Thank you. Ciao.
Thank you. Thank you.
Thank you.
Thank you.
Thank you all. Thank you. And we hope to see you again at our next webinar.
Oh, yes. Yes, indeed. Prof. Zotto, I applaud you.
Thank you for doing a great job. You are the time Africa needs.
I remember.
And there are many people we haven't heard their voices. Africa needs you.
Bye.
Bye.
Thank you very much.